The genesis of One Health in Tanzania actually starts back in 1925-26. And in those years is when actually we were working more on these zoonotic diseases. And working with zoonotic diseases transmitted from animals into humans, sometimes you need really as a vet to work with a medical to work with a vet, so that actually you can address that one at a holistic manner. And when actually it was started, it was just between these two disciplines, the medical and the vet. But thereafter, we came to realize, actually, when we talk about One Health, it's not only that one.
One Health is a collaborative effort that calls on different disciplines and different professionals to work together across national, regional, community level, as well as global levels to address some of the most pertinent issues that we face as a society, as human beings, some of the issues that are faced by animals, as well as the issues that are faced by our shared environment. One Health is special in that it calls on both government and non-government actors to be part of the solutions to some of the issues that threaten our well-being, our ecosystem, as well as our future on this planet.
The three main challenges, One Health challenges that we have in Zimbabwe, maybe I can just start with the top two. Number one, we have antimicrobial resistance, which has received a lot of attention and support at the moment. And the other issue is zoonosis. We are looking at diseases like rabies, anthrax, brucellosis. Those are some of the examples. And we are also looking into the emerging and re-emerging diseases, especially now it's important because of the context of the COVID pandemic.
Currently in Namibia, as we know, we are all being affected by the global pandemic, which is a zoonotic disease. And of course, in the past, we had, for example, hepatitis E as a big challenge in the country. And of course, we also challenged by high cases of malaria, as well as especially rabies amongst wildlife animals as well as domestic animals.
In Botswana, we have disease outbreaks, and an example is rabies. I mean, rabies is, for example, in Botswana, rabies, the way the way they've been dealing with rabies, it's like very reactionary. And a friend was telling me, who's a medic, that she gave an example of an area where wild animals were infected with rabies, and people were eating that meat from those wild animals. And she says it took a very long time for the medical fraternity to actually realize that there was a problem and somebody died. For them to find out that there was that problem, somebody died. Whereas if there was that integrative approach, they would have known right at the beginning when those things were happening.
One of the challenges is the coordination challenge, because One Health platform is led by ad hoc committees. So coordination is one of the challenges. On the top of coordination, there is a challenge of resource mobilization. So we need to have an institution which is responsible for facilitating communication and the resource mobilization.
We have a system in the government, particularly in Uganda, that does not favor or that does have weak coordination, where the sector of animals or the Ministry of Animals handles animal issues separately. The sector of humans or the medical sector or the health sector handles the issues to do with humans. The sector of environment and water is also separate. This is a clear incoordination that is weak, that is sector-based, that encourages activities in silos, which in a way compounds and affects the activities that should be tailored to working together.
For One Health, functional One Health structure, the key thing, one is the membership. It's important that that structure has all the relevant members, the relevant key players in One Health. So it should include all the sectors, include all the disciplines, and also both levels that at national and subnational level, that is the counties. Also a functional One Health structure is where there is a clear coordination structure and operational structure and the reporting mechanisms, how the various levels would communicate to other levels.
Communication is the key. Without proper communication, we cannot collaborate proper, we cannot draw documents that can guide us, the guidelines. So the communication is the key.
In Uganda, it's important that people or individuals are made aware. It's therefore, when you have a strategy, for example, of sensitization and creation of awareness, this will strongly go a long way in informing different professions, the need to work with others.
I think first of all, it's so important to start with sensitization for the public at large through various media and educational awareness raising campaigns where people first of all can understand the concept of what One Health is all about.
For an ideal Mozambique One Health in my country, I think we should have an institutionalized One Health platform, and then we have the sectors and having the command from there so that we could have the same resources for different sectors and to work together.
One Health Zimbabwe would be a Zimbabwe where we have strong collaboration between different sectors. And when we have breaking of silos, because where people are working in their different sectors and not collaborating, not working together. So a united front of different experts coming from different sectors.
A picture of One Health Rwanda, for me, I would say, is a country that has three components. There is the governance of One Health. There's the integration of One Health into the education system so that we are raising a generation of people that are passionate and willing to carry out One Health. And then it's community-based. One Health can't work without communities, and I think I've alluded to this earlier, but if One Health should be perfect in Rwanda, it has to be owned by the community. The communities. Conversations about One Health need to move from the platforms that we have otherwise had them in, whether it's government offices or workshops in hotels, and they need to move down to the community level, and they need to be had with the communities and between the communities. For me, I think that's what a One Health dream looks like in Rwanda.